Brother, I'm Dying by Edwige Danticat. Chapter 22, titled, Let the Stars Fall. My uncle's medical records indicate that he arrived in the emergency room at Jackson Memorial Hospital around 1 p.m. with an intravenous drip in progress from Chrome. He was evaluated by a nurse practitioner at 1:10 p.m., his pulse 80, temperature 97 degrees, blood pressure 169/78, checked and noted. At 2 p.m., he signed in an apparently firm hand a patient consent form stating, he did not fill in his name on the blank spot, consent to undergo all necessary tests, medication, treatments, and other procedures in the course of the study, diagnosis and treatment of my illness is by the medical staff and other agents and or employees of the Public Health Trust Jackson Memorial Hospital and the University of Miami School of Medicine, including medical students. At 3:24 p.m., blood and urine samples were taken. His urine analysis showed some blood and a high level of glucose. His CBC, or complete blood count test, displayed a higher than normal number of white blood cells, which hinted at a possible infection. The test also showed elevated bilirubin and abnormal gallbladder and liver functions. At 4 p.m., during a more thorough evaluation by the nurse practitioner, he complained of acute abdominal pain, nausea, and a loss of appetite. A new IV was administered. Chest x-rays and abdominal films were taken. Pneumonia and intestinal obstruction were ruled out. At 5 p.m., he was transferred to the hospital's prison area, Ward D. His Ward D admission note, which was also prepared by a registered nurse, remarks, "No acute distress, ambulatory, to IV, hydrate, and reevaluate, patient closely observed." Once in Ward D, where no lawyers or family members were allowed to visit, and where prisoners are restrained to prevent escapes, to protect the staff, the guards, and the prisoners from one another, his feet were probably shackled once more, just as, according to Chrome records, they'd been during the ambulance ride. He was given another IV at 10 p.m., at which time it was noted by the nurse on duty that he was resting quietly. He was to be further observed and followed up, she added. His vital signs were checked again at midnight, then at 1 a.m. and 7 a.m. the next day, when his temperature was 96 degrees, his heart rate a dangerous 114 beats per minute, and his blood pressure 159/80. At 9 a.m., he was given another IV and 5 milligrams of Vasotec to help lower his blood pressure. By 11 a.m., his heart rate had decreased to 102 beats per minute, still distressingly high for an 81-year-old man with his symptoms. The records indicate that he was seen for the first time by a physician at 1 p.m., exactly 24 hours after he'd been brought to the emergency room. The physician, Dr. Hernandez, noted his test results, namely his high white blood cell count, his elevated liver enzymes, and his persistent abdominal pain. He then ordered an abdominal ultrasound, which was performed at 4:56 p.m. The ultrasound showed intra-abdominal fluid around my uncle's liver and sludge, or thickened bile, in his gallbladder. Before the test was administered, my uncle was given another patient consent form to sign. He signed it less comprehensively than the first, next to a stamped hospital declaration of patient unable to sign. At 7 p.m., after more than 20 hours of no food and sugarless IV fluids, my uncle was sweating profusely and complained of weakness. He was found to be hypoglycemic, with a lower than normal blood sugar level of 42 milligrams per deciliter. The doctor on duty prescribed a 5% dextrose drip, and 20 minutes later my uncle's blood glucose stabilized at 121 milligrams per deciliter. It was then noted that he was awake and alert and his mental response appropriate. At 7:55 p.m., his heart rate rose again, this time to 110 beats per minute. An electrocardiogram was performed at 8:16. The next note on the chart shows that he was found pulseless and unresponsive by an immigration guard at 8:30 p.m. There is no detailed account of the code or the 16 minutes between the time he was found unresponsive and the time he was pronounced dead at 8:46 p.m. Only a quick scribble that cardiopulmonary resuscitation CPR and advanced cardiac life support continued for 11 minutes. Aside from the time he had throat cancer, my uncle nearly died on one other occasion. It was the summer of 1975, and I was 6 years old. He was stricken with malaria. Fever, chills, nausea, and diarrhea had sent him to his doctor, who'd hospitalized him. I hadn't seen him in several days when Tante Denise brought Nick, Bob, and me to the hospital to visit him. When we walked into his small private room, he was curled in a fetal position, and though he was wrapped in several blankets, was shivering. His face was ashen and gray, and his eyes the color of corn. "The children are here," Tante Denise had told him. He seemed not to see us. Grunting, he closed his eyes as if to protect them from the ache coursing through the rest of his body. When he opened his eyes again, he glared at us as if wondering what we were doing there. "I brought the children," Tante Denise said again. "You asked for them." He looked at each one of us carefully, then said, "C'est mon children." "Oui," we answered, a weak chorus of 5- and 6-year-olds. Looking at Nick, my uncle said, "Maxo, I'll be sad to die without seeing you again." Then turning to Bob, he said, "Isn't that right, Mira?" He called me Eno, the name of his dead sister. "Eno knows I'm right," he said. Then closing his eyes once more, he added, "Que tes étoiles yon tombent, let the stars fall." His words evoked a loud wail from Tante Denise, who grabbed us by the hands and pulled us away from the bed. "He's gone," she wailed. "My husband's dying. He's only speaking to people who are here." The fact that my uncle had asked the stars to fall was also not lost on Tante Denise, who believed, and had groomed us to accept, that each time a star fell out of the sky, it meant someone had died. I wasn't looking at the sky when my uncle died at Jackson Memorial Hospital, but maybe somewhere a star did fall down for him. Thinking, as Pratt had been told, that my uncle was only being tested and observed, I spent the day waiting for his discharge and release. But late in the afternoon, I had a terrible feeling and began to frantically call the hospital until I reached a nurse in Ward D, the hospital's prison ward. My uncle was resting, she said, and she couldn't allow me to speak to him since any contact with prisoners, either by phone or in person, had to be arranged through their jailers, in my uncle's case through Chrome. While Pratt pleaded with the higher-ups at Chrome to let us visit, I pleaded with the nurse to let me speak to my uncle, but neither one of us got anywhere, not even after my uncle died. When a close friend of Maxo's, whom Maxo had used his one allowable phone call from Chrome to telephone to break the news to me, I called Ward D again to ask if indeed it was true that a Haitian man named Joseph Dantica had just died there. The man who answered curtly told me, "Call Chrome." And when I did telephone Chrome, thinking I should have an official answer before calling my relatives, I was told by another stranger that I should try back in the morning. By then it was nearly midnight. "Don't tell your family now," my husband said, rocking me as I sobbed in his arms. "At least let them get this good night sleep." We spent most of the night awake, cradling along with my large belly this horrendous news that those who most loved my uncle were not yet aware of. Some, like my father, were probably still praying for his release and recovery. Others, like his sisters in Haiti, were surely worrying, dreading perhaps, yet never expecting this particularly heartbreaking ending. Waiting for daybreak, we reorganized the room in which my uncle was to have stayed, removing the paintings from the walls and stripping the bed of the sheets he was supposed to have slept on. As we slid the bed from one side of the room to another, I worried for my father. Would he survive the shock? Placing a new set of curtains on the windows after my husband had collapsed into bed, I worried for my daughter, too. How would this stress, my sleeping so little, my lifting and lowering of things and stooping in and out of closets in the middle of such a painful night, affect her? The next morning, my first call was to Carl, who conferenced the rest of the calls with me. We called Uncle Frank, who moaned loudly over the phone, then my mother, who, as always, was the most composed. "It was best that she, Bob, and Carl tell my father in person," she said. My father was in bed, weakened but tranquil after yet another sleepless night, when they told him. For a moment he was absolutely still. Then he pushed his head back and looked up at the ceiling, and then again at my mother and brothers. He didn't say anything at all. Perhaps he was numb, in shock. He didn't appear surprised either, my mother said. It was, she said, as if he already knew.